Davidson County Health Department is a large county health department affiliated with the state health department, but actually a department of metropolitan government. It delivers a myriad of services to the citizens of Davidson County, both through the primary clinic at Lentz, which is located on 23rd Avenue, as well as the satellite clinics that are located throughout Davidson County, the largest of which are Woodbine Clinic, East Clinic, and Lentz Clinic. The services range from services for infants and children to services for adults, for women, the WIC programs, just the gamut of public health services for the citizens.
Involved in public health service.
Yes, for the citizens of Davidson County, including animal control, including air pollution standards, emissions, including pool inspections, food inspections, as well as the health care services that are provided for the citizens of the county.
Anything that impacts upon the health of the community, the Metropolitan Health Department is concerned with.
Most definitely so, and even more so as they change their focus to Healthy Nashville 2000, and in looking at the community as an aggregate, and looking at the community as in assessing the health needs of the community in a proactive way, so that those needs can be addressed before problems arise, as opposed to reacting to problems that might arise due to any one of a number of factors.
Very good. Dr. Stephens, let's talk about infant health, because I think that when we talk about infant health, that certainly is a large category. But from your training and your teaching and some of the things that you've been involved in, why don't you give our audience some information this morning about what constitutes infant health, and what are some of the things that we ought to be concerned with dealing with infant health?
I'd like to start off with the concept of the total environment, because health is concerned with not only the absence or presence of disease, but also the total well-being of the individual in their environment. And this is particularly important when you're talking about infants and children. We have a community based in Nashville. We are in a larger community of the country, and we are citizens of the world. And what may impact children or adults in the other part of the world frequently comes to impact us as well, and we need to consider the entire environment when we talk about health. Starting with the newborn, I frequently will counsel my new parents that you have this new baby. Think of this new baby as a sponge. This sponge is going to sit there and absorb everything around it. You want to be very selective and critical in what the sponge absorbs. So you need to be careful in what you do, how you do it, and where you do it.
Even at that young age, that infants absorb some of the things that will be part of their culture later on. And so you counsel young mothers to be sure that they act and do things in such a way that can influence that child. Is that what?
Positively.
From a positive fashion.
For example, if a mother complains to me, I can't get my baby to eat. I said, has your child ever sat and watched you eat? Do you sit down and have a family meal? Or are you always trying to shove something in the child's mouth while 50 million other things are going on in the room? That might have something to do with why you can't get your child to sit down and eat.
If the child were to see her sit and eat, then the child would be able, is that
correct? Or take it a step further. I can't get my child to eat anything green. I said, well, have they ever seen you eat anything other than a bag of potato chips? They are sitting there watching everything you do, and they love to imitate what they see others around them doing. So I try to get parents to look at the world from their child's point of view so that they can understand and anticipate what might come next.
Very good. And of course, I think, Ms. Halpern, you deal with something that is quite specific in terms of the shots that young children have to have during their early infancy, as well as later on. And let's talk about that. I think that we've got a short break coming up here in a few minutes, but when we come back from this break, we want you to talk about some of those things that will have to do with immunization. I think that the audience is probably aware that today is fast approaching the end of the month of April for National Immunization Month, and that we might be a little tardy in terms of trying to bring this information to the audience. But I think that when we come back from this break, and we've got about 10 or 15 seconds to go before we go into the break, but when we come back from this break, we'll start with you, and we'll have you to give us some information about that. And we'll be back with you following this commercial break.